Hello, my name is Dr. Georgia Anderson, and I am both a clinical social worker and a research scientist, which is a fun combination. I have practiced as an oncology social worker for nearly 20 years, primarily in an outpatient clinic setting at the University of Cincinnati Medical Center. I also worked in social work administration, which included palliative care service. And then when I turned 40, I decided I was ready to go back to school to become a research scientist because I had a list of questions of, I wonder what happens when. So most of my clinical career, I focused on palliative care and preparing people for end of life and breaking bad news and being there for those hard transitions of care. So my research focuses on cancer survivorship. So how do we help people live as well as they can, as long as they can? And really helping people to advocate for themselves that it is not enough just to be alive, but to live and have a good life. I am particularly interested in my research also in working with cancers that have some sort of social stigma attached to them. So head and neck cancer, lung cancer, gynecologic cancers, colon cancer. I always say all the things that we don't necessarily want to talk about at the dinner table, I want to talk about with you. I want to help you work through that stigma and all the challenges. And sometimes I think we put the pressure on ourselves, even if nobody in society is bringing that guilt to the table and that shame that comes with those. So with that said, I know there are a lot of questions about what exactly does an oncology social worker do and why do I need a social worker? And I know that throughout my career, I would walk in the room and people would say, well, I don't need a social worker. I'm not poor. Or are you going to take my children because I'm sick? Because that is oftentimes the stereotype people have about social workers, is that is the only thing that we do. So I would have to reassure them that, in fact, no, that is not what I am here to do. So then the question really is, what does an oncology social worker do for you? So I always like to tell patients that I am the non-medical person on your medical team. So it is my job as a social worker to make sure you understand everything your medical team is saying to you. So sort of being the interpreter for medical speak. Even the most wonderful doctors with the most wonderful bedside manner sometimes, and I get stuck in it too, we use acronyms or jargon that maybe if you've never experienced cancer before, you don't know what that means. So as an interpreter, but also that goes the other way to help your medical team really understand what's important to you as the patient and help you create a treatment plan that you can tolerate and also meet your goals of care. So that's a really wide net of what a social worker can do for you. So I think it breaks down into some different sort of pools, if you will. So the first is emotional support. Okay, so you hear the word cancer. My family, we still can't say cancer. There's been a lot of cancer in my family. My relatives whisper, the cancer, right? It's a scary thing. It can, you go through anger. Why is this happening to me? Guilt. Oh my gosh, my health behaviors led to this, or shock, sadness, any plethora of emotions. And sometimes those all happen within a span of 10 minutes, which is normal. But a social worker is there to help you navigate those feelings and just sort of help provide. I always use the analogy that you are on a stormy sea as a cancer patient. It is my job to be the lighthouse. I can't necessarily make the waves go away and I can't make the rocks go away, but I'm going to help light your way so that you know where you're heading. Okay, so that is the best way I can think of to describe that. And so you might have a lot of different paths that need to be lit. So maybe you have questions, is my insurance going to cover this? Or I can't afford this copay for this medication. Social workers often are a really great resource to know if there are patient assistance programs, or they know when open enrollment times are for insurance. So maybe you could change plans, helping navigate if you're taking leave from work to help you work with your HR department for short-term disability, those sorts of things. So I would say I don't know all the details of those, but I know who to ask to get those questions answered. And I will help you figure out what questions you need to ask, which I think is one of the great hallmarks of social work. We're kind of the go-to of just these practical sort of things. Cancer does not care if you are rich or poor or somewhere in the middle. Financial challenges can arise no matter what. So social workers are really good about knowing organizations that we can connect you with. So for example, in the head and neck cancer space, a lot of my patients had feeding tubes because they had challenges with eating and swallowing. And so they needed supplemental nutrition, and that stuff is not cheap. So I sort of had developed a database when I was practicing of, we can call this company, or certain pharmacies, will have discount programs. So knowing that sort of thing. As one of my patients not so politely put it in the waiting room one day, he was an elderly man, and he saw me, he was chatting with his buddies in the waiting room, which, sometimes you make friends because they're all there, you're all there on the same treatment day. And he saw me walking through the lobby and he yelled, "Hey, there's the hookup lady," meaning I could hook him up with resources, but that caused a whole hullabaloo, which is another topic for another day. But we can hook you up with resources and help you figure out where to go for help, even if we can't provide it directly. We also just provide support for living with cancer. There is no correct way or wrong way to do cancer. So your social worker can really be a resource to help you figure out, like, is this normal? Or what do I do with this? Or I didn't know my relationships were going to change. I'm tired of my family babying me. Like, I can still do, like, I'm still Georgia. I'm just Georgia with cancer. I can, I want to do things I did before. So helping navigate those family things, and also being a support for your family. So your caregiver, whoever that might be, or your support people, of helping them figure out and helping coach them. And sometimes they struggle, like, oh my gosh, I made food for this person, because, we feed people when they don't feel well. And certain cancers, eating is not easy, especially, my folks with head and neck cancer. That's a real challenge. And so the loved ones are like, I made them all these smoothies and they don't like them, or they don't, they said they wanted it and I brought it to them and then it didn't taste good. So just kind of helping them navigate those things of, it's not about you. This is about the cancer, and helping to maybe facilitate some conversation in how we talk about those things that are hard or scary. We also know from caregiver literature, I always use the analogy, it's like if you've ever taught somebody to drive and you're sitting in the passenger seat pumping that emergency brake because you're not sure if they're going to stop, that's often what it feels like to be a cancer caregiver. The patient is in the driver's seat. They have control of the car, but as the passenger, you're not really sure. You're just kind of along for the ride. So your social worker can help you navigate those sort of dynamics and help facilitate those conversations. Oftentimes, social workers will facilitate support groups or can help connect you to other people with your particular kind of illness. Many cancer centers have a mechanism to do that, and oftentimes your social worker is sort of the person that puts those connections together. And we also, and this is my favorite part of being an oncology social worker, is helping to facilitate those care plan discussions. So what I mean by that, I don't know what the chemos are. I don't know what all the side effects are. That's not my job. But I do know that if a patient says to me, I'm on this chemo and I am sick as a dog and I want to feel well enough to attend so-and-so's wedding, and I want to dance the Cupid shuffle, I want to do the wobble while I'm there, then we can help you talk with the doctor about, is there a way we can adjust this dosage so that it still meets that goal that we're going to reduce your cancer, or, keep your cancer at bay, or whatever your goal is, but maybe let you feel well enough that you can, enjoy those big moments in life. So as you can see, social work, we are kind of the Jack and Jill of all trades and master of none. But we really are there to support you and your family. And the hallmark of social work is really to meet you where you are. That's sort of what we teach in our social work classes, that it is not my job to judge you about anything. It is my job to understand how you experience cancer, how it impacts your life, and how can we help you move forward and cope as best as you can.